The COVID pandemic really underpinned the importance of global standards in healthcare.
The supply of a lot of products as a result of COVID-19 across the world became very critical in short or limited supplies.
It's personally painful when we would see inventory trapped someplace where you need it somewhere else. And they may have picked a location that's not where we wanted it to go, and that you can't get it or you can't find it because we don't have that visibility.
In order for us to be able to find where our supplies were, to predict how long our supplies would last, we had to understand the source.
We have learned that we are all dependent on efficient and safe supplies and supply chain, and standards make it just so much easier and much safer for us to provide health care.
It's that fact alone that has made us realize that we have to do it with global standards being applied.
As we look at the future with the vaccines that are coming in, the challenge or the issue we will have in the very near term is going to be identifying perhaps what products were given to which patients and when, if they don't happen to have that barcode that can be scanned and captured.
And that's what GS1 is all about, is how we're accelerating this impact really on outcomes, on the healthcare outcomes for people around the planet.
Dear ladies and gentlemen, dear colleagues and friends from across the world, welcome to our first executive dialogue on a topic which is so close to our hearts and minds these days, COVID-19 and the vaccines. It is a good year now since Greg Ray, who is the global lead of life science at Deloitte, and will be your moderator also today, and I met at a meeting in Davos, where we discussed the need to fight Ebola with collaboration between private and public and an efficient supply chain. Nobody in this room of experts at that time thought that we were at the brink of a global pandemic. A pandemic where we have seen in the meantime nearly 100 million cases and more than 2.1 million deaths. We need vaccines. That is our hope for the future, to get back to a normal life and to overcome this global health crisis. But we need also medicines and medical devices to treat our patients. And we need a secure and efficient supply chain which creates trust for all of us. And that's the topic which we want to discuss today. And before I hand over to Greg, who will moderate this session with you, I want to remind everybody of the GS1 antitrust caution, which is important in all our meetings. So I ask everybody also in the Q&A later not to touch on customer prices or anything which could lead us in antitrust issues. And with that, it is my big pleasure and with a big thank you that I hand over to Greg.
Ulrika, and thank you and the entire GS1 organization on behalf of the panel for inviting us today to share our thoughts and perspectives, specifically on the role of global standards in the distribution and administration of a vaccine. As you said, this is such a critical component, and it is remarkable, as you said, given a year ago, the conversations that we had and where we are today. But I'm delighted to have joined with us today Lisa Hedman, who's the group lead for supply and access medicines at the WHO, Jalling van der Schoors, who's the director of professional development at the European Association of Hospital Pharmacists, and Tom Woods, who's an advisor to the World Bank. Additionally, we'll be joined by some representatives of the EMA later on in the session when we do our Q&A. Lisa, Jalling, and Tom will each have some time to provide their perspectives, and then we'll open up the last half of the hour for Q&A. I'll remind everyone that there is a Q&A function, so please use it or the chat function to ask questions either along the way, and I will do my best to capture them and ask them of our panelists. Certainly since the beginning of the pandemic, the importance of trust has been amplified, as Ulrika alluded to, and it's truly been tested at many levels in governments and health authorities, private companies, NGOs, and certainly between ourselves as citizens. And while it is the connective tissue that binds us together, it is also the most fragile aspects, particularly in the pandemic response. Trust has always been an essential component in healthcare, I think, as everyone on this call and joining is well aware. And it's hard to imagine a successful outcome of the global COVID-19 vaccination effort without it. There's some great examples of the role that trust has already played, particularly in the development of therapies and vaccines and the collaboration it enabled across the biopharma industry. And it's that level of trust that needs to continue and endure throughout this response in order for the outcomes to be as we all hope them to be. In a paper that we recently published, we made the case for the adoption of global standards as a key enabler of trust, particularly in the distribution of vaccines around the world. Now, the benefits of traceability have been well documented over time, and those benefits range from everything from improvements to overall supply chain operations to effective pharmacovigilance, and indeed the mitigation of counterfeit products. And each of these is an element that engender trust across the board. But given the complexities certainly that are accompany the administration of the COVID-19 vaccine, it will be critical to ensure stakeholders are all moving in the same direction and utilizing common standards that enable everything from product visibility to product integrity. And trust that the last mile and indeed in the last foot will mean that safety protocols are followed and patients can be assured that the vaccines are safe and effective. And so with that as a background, I'd like to invite Jalling to share your perspectives, particularly given your role as a provider, and would love to spend some time in getting your thoughts here, and then we'll hear from the other panelists as well. So I'll pass it to you, Jalling.
Thank you very much, Gregory. And good morning, good afternoon, and good evening to all of you who are listening and watching. So thank you for giving me the opportunity to present today. And as said in the introduction, I'm a board member of the European Association of Hospital Pharmacists, but today I will present from the perspective of a healthcare provider. I work in a hospital of which the first written records go back to 1347, the year the biggest pandemic started, the plague or Black Death. Now we are all faced with a new challenge, fighting COVID. And it is good to see so many united around the world to this cause. I feel privileged to be able to play a very small part in it as well. And we are well on the way to treat and hopefully beat COVID. We are at a point on the way that more and more vaccines become available, but the end of the road is still unclear. Will the vaccines be effective? And will they remain effective? How do we go about making sure these effective vaccines reach the public? How do we organize the vaccination process itself? When you receive a vaccine, would you want it to be the right one, in an adequate dose, and of indisputable quality? Adequate vaccination saves lives, as Walter Orenstein said, not the vaccine. And adequate vaccination is all about the P, the person, the product, and the process. The person, you, the product, the vaccine, and the process to get the right vaccine to the right person and have adequate monitoring. So let's look first at the person. But let us not spend too much time on the characteristics of a person. A person is incomprehensible. A famous football player once said, "The highest achievement of human knowledge is to understand that he cannot understand." And if one can't get this statement right away, that's just underlining my point. The second P, the product, is complex. Years of research and science are at the basis of the development of a new medicine. The development process of the medicine itself consists of 4 complex stages of development and trials. And then only after thorough scrutiny of the results of these trials and assessment of adequate safety and effectiveness, the vaccine is released for use. Then the third P, the process for getting this valuable vaccine to the person. Although much effort is given to the development of, in this case, the vaccine, the process of getting the vaccine to the right person and having proper recording of it is often underestimated. The distribution process is complex in itself. As I am talking from the perspective of the healthcare provider, we will focus on the last part of the supply chain, the process around the administration of the vaccine. And at that point, we have to be very much aware that not only the product is important, but the information management before and after administering the vaccine is equally important. To facilitate the physical process, standardized barcoding up to the point of the administration of the vaccine is essential. It is essential for track and trace, for stock keeping, for counterfeit prevention, for quality assurance of the product, and matching the vaccine with the person. But also for facilitating record keeping, for pharmacovigilance, for recall purposes, and research purposes. Now, one would think if this is so important, they will be applied. Yes and no, unfortunately. At present, we see vaccines that do have barcoding on the outer box, but not have barcoding on the multi-dose vials, even though these vials, after unpackaging, are again redistributed. Now, when the product is right, but the process is not executed correctly, we get a fourth P, a problem. A very common problem is an administration error at the point where the medication is administered to the patient or with vaccines to the person. Of all mistakes in the medication processes, 40% is made at the point of administration of a medicine to the patient. And up to 98% of these go unnoticed. There is much harm that can be prevented here. We should be aware that not only giving a wrong medication to a person can cause problems, but also incorrect record keeping can cause problems. In a complex environment for COVID vaccination, with multiple vaccines and every vaccine with many batches, with multiple storage conditions, with multiple dosing regimens, multiple population targets, redistribution of vaccines, error prevention is crucial. Research has shown that when we apply barcode scanning at the point of administration, the amount of errors will be reduced significantly by as much as 80%. And not only that, as said, it also facilitates information transfer to patients, enhances record keeping, facilitates recall, facilitates research, and facilitates the process. We all would be very much helped by being able to use barcodes at the point of administration, especially with emerging mutations of the virus and possible resistance development. We need to be able to recall which person received which vaccine. Now, what are the conditions? To be able to scan at the point of care, barcodes have to be present on primary packaging, or at least on multi-dose vials to support the process. These barcodes will have to be standardized. And of course, means will have to be present to scan and register. As these barcodes can be scanned by mobile phones these days, the solution can work in any setting, either for central registration or using apps for processing of the data. As data can be linked to persons, a very important condition is, of course, adequate privacy protection. Now, when you receive a vaccine, would you want to receive the right vaccine and the right care before and after receiving the vaccine? So let us build safe systems for now and the future. So we not only have the right vaccine, but the right vaccination to protect the people and eliminate problems. I thank you for your attention.
Thank you, Johnny. Really great insights there from a provider perspective. Lisa, if I may ask you, obviously the WHO has recommended barcodes and traceability standards, as well as a number of other agencies and UNICEF and Gavi and others. Would be great to get your views on kind of the ongoing activities and in this space from a WHO standpoint.
Thanks very much. I think there's some slides that we may be able to show for this. I'm not sure if those are loaded, but why don't I go ahead and get started while we load up the slides. I think the thing that's, going to what the previous speaker said, I think, and just to comment on this overall, trust really comes from having a common understanding, and it comes from being transparent about what you're doing. And one of the things that happens in a pandemic is that things change. They change rapidly, and they can change drastically. So what we think is a good idea today may not be a good idea tomorrow. The roadmap that we might have been building might not be the same as what we do in a pandemic. And so it does make trust harder. And so that's where we have to add patience along with trust. So when we look at our supply chain operations and we think about how do we come to trust each other, first, we accept that change is inevitable and it's going to be rapid change. And the second thing is really that we do want to be transparent. We do want to talk about what we're doing. So what I'd like to do is just get into some of the specific details that WHO has undertaken in terms of what is it that we're actually doing. So I want to bring up three things. I think you can probably see those slides at this point. I'm going to bring up three things in particular, and we don't have an endless amount of time today. So what you can see is that you have a website associated with each of the 3 points, and that gives you the opportunity to actually go look at each one of these areas from the WHO or one of our partner websites. But what I do want to explain a bit is that there's three key things that I'm going to share with you. The three key things are a policy brief. Fortunately, this is something we started on before the pandemic. WHO recognized the importance of traceability in medicine supply chain. And we also recognize that there are a large number of countries, mainly low and middle income countries, that have not yet embarked on developing these types of systems and using these technologies. And so trying to support countries in doing that was an important area for us. And I'm going to speak a little bit about each one of these things in more detail as we move on through the presentation. The second is that clearly we have to have some reference point for what we're doing in COVID-19. And that goes back to the point I made earlier, that as you see these documents move forward, they are going to change. So people do look to WHO and its partners, its UN partners for guidance. And one of the things that you'll see, we'll be putting out what we call working documents. And that's to acknowledge the fact that we need to be able to be resilient. We need to be able to respond to change. And I'll give an example that goes back a little bit to what our previous speaker talked about in terms of the vaccines. One thing that you can expect to see with the vaccines, the early vaccines will have very limited shelf life. That's simply because they were developed quickly, and that there's some data that we normally would have let accumulate over time that will continue to accumulate over time, but won't let us put long shelf lives on these products initially. So some of the guidance that you see will change because of things like that. That's not the only thing that will change, but that's a good example of why you're going to see a changing environment. So you'll see a series of working documents, and we post those on our regulatory website. A third piece that you'll see that's quite interesting, and it's related to supply chain, is that connection to regulatory affairs. Most of the implementers and enforcers of traceability systems and also the use of 2D data matrix codes for other types of information sharing are governed by either a procurement authority, usually, or in a lot of cases, regulatory authorities, and in some countries, it's going to be both. So I want to take a moment to go into the next. I want to talk a little bit about what the policy brief does and what it doesn't do. And I think that that's an important issue. This policy brief, and again, this started before the pandemic. And so it's very fortunate that enough of this information had been gathered to support what we refer to as our member states. That's all countries. It talks about what kind of technology you need. It talks about the infrastructure, human resources, market dynamics, how regulatory affairs work, data governance, which is obviously an important aspect when we talk about traceability. Who owns the data? What can you do? What can you not do? And how do you want to use the data? If you haven't set that up in advance, I think having a global data standard is really where we need to go. But it's important that all that be set up before you actually start your implementation, because trying to create new data going backwards, we all know that doesn't work. Financing is a big issue for some countries. Traceability systems have a cost. I think, as Ulrika pointed out in her opening statements, the benefits of these systems have been well documented. That doesn't necessarily mean that there is capital available. And so the development of sufficient financial resources is a critical issue. So the policy brief from WHO lines this out for a country who is interested in wanting to develop and moving toward the building blocks of putting a traceability mechanism or system in place. When you see something from WHO, you'll see that we're neutral. We're neutral to member states, and we're also neutral to brands. We don't necessarily endorse particular brands or call out particular countries for things, but it's recognized that a global standard is really where this needs to go. I want to talk a little bit about what a policy from WHO does not do. It doesn't enforce. It doesn't say you must do this, and it doesn't come along with a mechanism to go out and measure who is and who isn't doing it as a way of promoting compliance. It's there to be supportive. It's there to add value, and it's there to create a stable technical environment in a public health system. So I want to, and again, you've got the website. You can take a look at what that policy brief says. And again, the reason for showing this is that we want to be able to share what we've shared with our member states in terms of what we're promoting. Moving a little bit to working documents that have more to do with COVID-19 and the supply chain. I've provided you the website, and one of the things that you're going to see is that we have some very specific recommendations that we put out. My point earlier, this is a working document. This will change. And it could change as soon as next week. So please do continue to watch these spaces as these documents get updated. I want to talk a little bit about that issue of trust and supply chain. You saw on that front slide that I mentioned, there is a structure referred to as the COVAX facility. It's coordinated by the Global Alliance for Vaccines, which is Gavi. And this is a mechanism where vaccines are, the cost for certain vaccines are going to be covered for countries that don't have sufficient purchasing power. It's a collaboration. It's a complex collaboration. I won't go into the details of it, but I really do encourage you to read it. It might not sound like a fun thing to do, to go and read a website of a UN agency. But if you do have time to read about the COVAX facility, it talks about equitable access. It talks about how vaccines will be allocated across countries that can self-finance, and it talks about how vaccines will be allocated to countries that are perhaps going to be dependent on some other type of external financing, which may be from UN agencies or other bilateral sources. But the point of the COVAX facilities is to ensure that countries have access to the vaccine at an appropriate time as they come off the line, not as a donation after someone has identified that they have extra, not as a donation at the end when the prices have gone down, and not at the end when it's no longer relevant or where it's too late to be effective in a public health context. That's what the COVAX facility is set up to do. Our guidance supports the COVAX facility. And so what is it that we need to do? We need to make sure that the vaccines have traceability information on the cartons. We know that not all countries are going to be able to use that. In the initial phases, we know that some of the countries that will receive vaccines don't have traceability systems. They won't be able to immediately uptake. And so that's an issue that we understand, yet we are still, and you'll see in the working paper that we are still promoting the use of barcodes on the vaccines. We're promoting it at the moment on the secondary packaging. That could change, knowing that countries who are moving toward development of a traceability system will have some building blocks to build before they're able to use point of care data management and systems. We're also building pharmacovigilance systems for countries that need support, and eventually that will move to being able to trace patients to vaccines for pharmacovigilance purposes. One thing that I do want to mention is that when we make recommendations like this, particularly in a complex space, traceability systems do require a big investment for some countries, and it will take them some time before they're able to actually have a mechanism or a system in place where they can actually take advantage of traceability systems. One of our partners, obviously, in COVAX and in our everyday work is UNICEF. UNICEF is the procurer and the distributor of the vaccines for many of the countries. Our documents are well aligned with what you'll see in the procurement tenders that they put out. We're very careful to make sure that we don't have unaligned policy guidance across the UN agencies. One of the other initiatives that UNICEF will support has to do with managing a data resource for countries that don't have a traceability system in place. That's very important. And what it does do is it gives us an opportunity to say, well, we have to put something in place for an emergency, for this emergency, for countries who don't have access to traceability systems. So something will be put in place. And what's important is that we don't put something in place that's really just there for the emergency, and then you throw it out and you don't use it again afterwards. These systems that will be put in place represent building blocks that can be used to develop broader traceability systems in the future that can encompass a broad range of products and that will be used beyond just the emergency setting. And I think that's a very important point, that we have to be mindful about that. What you do in an emergency can follow along something that I think many of you have heard. There's nothing so permanent as something temporary. So as we put these measures in place, we're very mindful to make sure that the support we provide not only addresses the emergency, but addresses that need to have building blocks in place to allow the future to unfold from there. The last piece that I do want to talk a little bit about is regulatory updates. I think that you will see I've given you a website that you can look at. Some of the things that you will want to be aware of in terms of the policies that we are promoting, but also just the activities that we have ongoing. This website will give you information on which vaccines are in the pipeline, which ones you can expect to see coming out into distribution. It focuses on products that are coming through WHO pre-qualification and the COVAX facility. If there are vaccines that are not going through that mechanism, they won't be included here necessarily. And certainly there's other resources where you might be able to find information about them, but we won't be tracking that, the progress of vaccines that are not coming through the COVAX facility. But I think you're going to find this a very useful website. One of the things that it also talks about is the issue that we're all concerned about, which is substandard and falsified medicines. You've noticed I didn't use the word counterfeit. Counterfeit tends to, by definition, have a third component, which has to do with copyright infringement and intellectual property violations. What we monitor on WHO's side is separate in that regard. And so from our regulatory affairs group, it really focuses on the substandard and falsified. Traceability systems are very, very helpful in managing that type of a problem. It certainly doesn't stop clever people from falsifying products, but it does make it a lot easier to go into your supply chain and see where the product entered and how it entered so that you can close off that stream. So another very, very important element of this is not only pharmacovigilance, where we ultimately will have the ability to match a vaccine to a patient to follow any type of adverse event, but also so that if there are situations where a vaccine is falsified, that you can identify where in the supply chain it was falsified and turn off that channel. I think I'm going to go ahead and wrap up there. I know we have a question and answer session, but I do want to express my thanks to the organizers of this meeting for making this happen. Again, trust is based on transparency and it's based on common understanding, and that's something that we really do want to support. And I also want to thank the other speakers for their insights and the extremely valuable contributions. But I think the most important thing is that we're aware of how many people have signed up for this seminar. And we're extremely grateful for the interest. We're extremely grateful that you're spending the time to join us and essentially join a platform where we all see things from a common voice and from a common understanding. Thanks very much.
Thank you, Lisa. And we are having a number of questions coming in, so we'll get to those shortly. I'd like to pivot now to Tom. Tom, you've been a very vocal advocate of traceability solutions, and great to spend some time getting your perspectives on progress and perhaps some views on what needs to continue to get done and the timeframes that need to get done in.
Good, thanks. Good morning, Greg. Thank you. A very good morning, afternoon to everyone. Very early morning for me, so please excuse the cup of coffee here. I was excited to join this discussion with GS1, Team GS1. It's good to be back together. I consider us all part of that broad family of GS1. In fact, I reflected it was about a year ago that we were all gathered in Brussels for the Global Forum. And who could have known at that time what the world would go through in the coming months? So good to be back together. And thanks to Deloitte, Greg, for the excellent report. I think you put your finger on a very important issue, this issue of trust as it relates to the COVID vaccines. And I think it wouldn't be hyperbole to say it's probably the most important issue facing the entire world. You know, millions of people have either rolled up their sleeve to take the jab, as we say, for the vaccine, or they're, you know, very eager to have that opportunity. And then many more are in kind of a wait and see mode for a variety of reasons. So I'm watching the distribution both here in the US and around the world. And obviously it's a complex operation under the very best of circumstances. And we all have a vested interest, a very personal interest in having this succeed. So I started to think, what part of this broad war on COVID can we grab and really make a tangible difference? And it is this issue of trust, and more narrowly, the issue of how do we have trust in the supply chain, and indeed the quality of the vaccine that we're actually sticking in our arms. So undoubtedly, there's going to be hesitancy to take the COVID vaccine. But I think the emphasis here, and you've heard it from a number of people, the prospect of having a fake vaccine should not be one of the reasons that we're hesitant. Okay, so in my view, we can have these very carefully scripted behavior change messages, global awareness of the vaccine. That's all going to go out the window if it gets out that fake vaccines are floating in the legitimate supply chain or they're showing up in the marketplace. So we can have carefully scripted awareness raising messages, but we have to protect the vaccine. And really, that's why, as chairman of the Global Steering Committee for Quality Assurance, which is hosted by the World Bank, and it's this multi-donor sort of platform that we're using to orient our work around protecting that supply chain for the vaccine. That needs to be a very key focus. So what do I mean here? You heard Lisa mention the COVAX facility, very important. It's being coordinated by Gavi, the Vaccine Alliance, UNICEF, World Health Organization has a very key role, CEPI, and they're all going to procure and distribute COVID vaccines and therapeutics on behalf of 180 countries. Well, that includes most of the lower and middle income countries in the world. And while it's undoubtedly an enormous challenge, here's where I'd like to outline the enormous opportunity that I see in all of this. So as we prepare to distribute this life-saving vaccine, and I would describe it as more precious than gold, and it's about to hit the markets in a lot of places and go through sometimes, kind of vulnerable supply chains, we really have to think about how we're protecting that very precious commodity. In fact, most of the countries in this COVAX facility who are poorer countries don't have any sort of traceability. They don't have a track and trace system. It wouldn't surprise many of you listening to know that many rich countries don't have an adequate traceability system. So adoption of the global standards for medicine's traceability was, it was already kind of being looked at very closely. In fact, I give a shout out to all those who were with me in Lagos, Nigeria for the GS1 Africa Healthcare Conference, where we had many, many countries pledge to embark on a traceability program. And that sense of momentum was going. And, it seemed like a no-brainer for regulatory agencies. Who wouldn't want better visibility into their supply chain? Who wouldn't want to combat theft and diversion and falsification? So they saw the big opportunity. And then along came COVID. And for a time, it seemed like that momentum that we had built up would be stopped. And that it would have to take a backseat to the broader COVID response and the pandemic response. More recently, however, though, I think people have come to realize it's not an either or proposition. In fact, we should be doing both. The idea of doing traceability for the COVID vaccine, it can be a very important tool in establishing trust in that vaccine and acceptance globally. So we see it as an opportunity. Now, I don't want to paint, too rosy a picture about this. We need to be highly pragmatic. And I think it's been said, we're not going to have a full track and trace system in countries that are starting from a very low base, okay? But we have to start, and we have to start to put those building blocks in place. That's why we're calling this essentially a lean traceability sort of approach. And that's established, that's based on the establishment of what we're calling a global trust repository, which essentially is going to be kind of a hub and spokes sort of model, which will create greater visibility in the supply chain. But we can't let the best be the enemy of the good. And what do I mean by that? This global trust repository is not going to have all the functionality of, say, the current European model, which we may hear about soon. It will have similarities, but it won't have all those bits of functionality. But it's important that we start, and it's a key building block. And I think, just to echo what Lisa said, it's important that we put in place a system that we don't throw away after the pandemic, but it becomes a firm foundation to build on and go forward to enhance health system security and integrity well beyond COVID. So through this global steering committee at the World Bank, we've put together a very broadly consultative process. It's made up of leading vaccine manufacturers. It's made up of the donor institutions. You've been hearing about the big health financing organizations like the World Bank, like UNICEF, Gavi, the Gates Foundation, USAID, many others. And we've come together also with solution providers, tech companies. You'll know many of them who are very involved in these processes and have been successful in implementing them around the world. And then last but not least, and in fact, most importantly, I think, is the regulators themselves in countries. We need to have them at the table planning with us. And we don't want to bring a cookie cutter approach or some sort of pre-cooked solution. So we're weighing the emergency of the situation with the need to build consensus around what the solution should actually look like. And that's what we're engaged in doing right now. So let me stop there. I'm going to thank Deloitte and Greg for hosting us here today. Certainly thank Team GS1 for the opportunity to highlight this issue. Again, I would just say we don't want to overpromise. We don't want to overreach. Instead, we want to look at the undeniable need to protect this precious commodity. So as we build this out, we know we can rely on GS1 standards. They're working around the world. And we have many other tools that are already in our hands. And I look forward to kind of unpacking that a little bit with you in the question and answer period. Thanks very much.
Thank you, Tom. And thank you all for your efforts, both individually and through your organizations in battling the issues that we all know and are aware of. We've had, as I mentioned, a number of questions come in, and Tom, maybe I'll just start with you to, given what you just described, and I think you have paint a very it's optimistic or hopeful, I should say. I know you're not trying to overpromise. I guess one of the questions, actually, a number of the questions are in and around the notion of adoption and moving from preferred to required. And I guess what I mean by that, or what the questioners mean by that, you've outlined, as did Lisa, how regulations and whether it's from the procurers like Gavi and UNICEF requiring manufacturers to have barcodes on primary packaging, and let's assume for the moment that those are obviously more enforceable than the broader adoption of traceability systems. You mentioned a group of stakeholders that have come together to address this for the Global Trust Repository. In that last step, I guess, do there remain, I'm sure there are, but barriers to overcome in terms of adoption and balancing everything from data privacy to various other very local issues, and are there things that from a collaboration perspective that can be done to overcome those barriers?
Yeah, that's a great question. So again, not too rosy a picture, but very optimistic, because what I've seen from the very time we began this process of bringing together this kind of multi-stakeholder approach is just lots of collaboration, honestly, people trying to problem solve. I've been impressed by the manufacturers themselves. I've been impressed by the solution providers. The donor agencies are coming around the issue. So, Lisa flagged some of the things that we're going to have to wrestle with. I'm concerned with what does the governance look like of this global trust repository? How do we move that forward? We have some examples in Europe and other places. Manufacturers, again, have been very compliant, very willing, but there are limits to what they can do. We've heard that to be able to track and trace to the point of dispense, you need primary packaging labeling. Well, we may not be there yet. But again, my emphasis is on saying, let's not let the best be the enemy of the good. There are things that we can do short of full track and trace that will bring benefit and help us protect the COVID vaccine.
Excellent. Lisa, I'll invite you to opine on this as well, just given some of the frameworks that you had outlined in your presentation.
Yeah, I'll comment on this same point. You bring up a good point when you look at things like you'll find guidance that in one sense says it's required, in other senses it says it's recommended, and in other senses, other places you'll find references to things that say critical characteristic. And I think what's important is two things. One is as we develop that common understanding is to recognize that that language has a different implication in a different context. In a tender, you probably wouldn't say it's required unless you had already achieved that global standard. And when we achieve that global standard, it's more likely that that would come out as a requirement versus a preference or a recommended characteristic. You can sort of see the problem here is if someone can't comply with that global standard that we still are working to promote, that we risk losing some of our manufacturing base. So there is a continuum of activities that will take some time before you'll see universally something like a requirement across all activities. So it's important to understand that the implication of saying something's required changes based on the nature of the activity. If you're a procurement agency, it's one thing. If you're a regulator, it's something else. If you're an immunization program, it's also something else. But what's very important is to recognize that in that continuum of moving toward this global standard, not everyone is going to implement at the same pace. And so the day that you can really universally move toward things being required at the same, that are all the same is a ways off, but really reinforcing what Tom has said. Let's not wait for perfect. Let's move with what we have. And then I think that's probably the most important message that we can give is that we know it's not going to be perfect right now, but that moving forward in a rational, and of course it's a stepwise approach, but in a rational approach that supports what countries need to do and supports these priorities of being able to track the vaccines to patients, to facilities, to avoiding substandard and falsified medicines, to supporting pharmacovigilance, and also managing a supply chain. And I think I'll quote Tom again, I think he said it was more valuable than gold. You want to be able to keep track of that product. You want to know where it is and who has it. So again, we won't be perfect for these first couple of years. And we do have to recognize that going forward and building, we're building this ship as we're sailing it in some countries. But we have to pick between doing that and waiting for perfect. And I don't think anybody would encourage us to wait for perfection. I think everybody would agree that even though we have to build the ship while we're sailing it, that's probably the preferred approach where we're going forward. Thanks.
Thank you, Lisa. Jolly, maybe if I could turn to you and get some of your thoughts on this question, as well as, we've been talking about, global standards, but, the role of education for administrators and providers in the field, just given the scale of this endeavor globally. We're already seeing a number of health authorities roll out new platforms to educate, or building new platforms to educate practitioners. But how do you see that coming together in terms of overcoming some of these barriers that we've been talking about?
Yeah, well, thank you very much. Actually, I fully agree with Tom and Lisa in that we have to be pragmatic about it because it's complex. It's complex because of the many issues that we can address by building this system like this, like what we are saying. Well, the problems with the counterfeit medicine, problems with the supply chain, and also the making sure that we have proper identification. And so we have to look at the different places where we want to use it. And what I do see is that making standardization in this can help in many of these steps, but we can't tackle them all at once, and we have to build. So that's one point. The other point of education, of course, for building trust, education is essential. And I think that healthcare providers in itself, they are crucial in also educating the population. So for that, I think that both are true. We have to have the system, but we have to make proper use of it as well. And so the education and the proper use of it needs the education of the healthcare practitioners.
Thank you. Zygmunt, thank you for joining us. A question came in related to the EMA, and I'll read it here. But as the EC has released the 3 proposals in the Health Union package, one of them is related to the mandate around reinforcing crisis preparedness and management of medicinal products. I guess with that enhanced role that the EMA is taking, how is the EMA preparing for that extended mandate?
Thank you. My name is Sigmar Stevers, and I work at the European Medicines Agency. And indeed, as you mentioned, there has been a proposal made by the European Commission with regards to enforced mandate for the EMA, including for preparation for events like COVID-19. And we are working currently to prepare for it, but considering that this is currently a proposal, there is not much detail that we can share, but we are following this very closely and would, of course, would make all the steps that would be foreseen in this mandate. It does, however, of course, build on the many things and activities that the agency is already undertaking within the existing mandate. And during this COVID-19, there have been a lot of additional activities that we have put in place. We won't have time to go through all the details of them, but this certainly is something that we are working on already before there is a formal mandate, and more resources and more can be done in a wider sense. But we certainly recognize that this is very important aspect, and supply chain and availability and avoidance of shortages, and also the traceability that is much discussed today are very important aspects, both from the perspective of falsified medicines, where you know that Europe already has this unique identifier system in place, even though we sometimes are faced with some derogations that may be necessary in some situations, but that goes into this direction, and in some extent even further it goes to not just identification of the batches, but individual packs, but again, that's probably too much detail. And then also the traceability that was discussed from the administration point of view. So what are the convenient and effective ways how to record this traceability information to match the vaccine with the individual patient who received what kind of vaccine is also something very important that falls outside of the Falsified Medicines Directive, but that is something that is also needs to be considered for each vaccines, how that labeling and any barcoding on it is suitable for these tasks. And then also another element that becomes important is, as these various barcodes multiply, that they do not get too confusing. So for the user, it's still clear what barcode is used for what, as we also have sometimes the QR codes that may lead to the package leaflet and some additional information that is provided for the user, so that they're also still distinguished and the user understands what he needs to use for what. But if we follow with interest these discussions, and these are very important points that need to be considered. Thank you.
Thank you, Sigmar. I guess one question, maybe it's for each of you, maybe could opine on it, because whether it's the Global Trust Repository or the European version, certainly we have versions of this in the US with the CDC VAMs and the various states IIS systems. But be curious to get your thoughts on that the constant balancing act between transparency and data privacy, and in particular, with some of the privacy regulations that are in place. Do you find that the initiatives here will be able to be executed in the context of those regulations, or are there other changes or aspects that need to be addressed as part of that to ensure outcome? And I'm remembering your words, Tom, and not letting the perfect be the enemy of good, but I think it's a topic that's come up in a couple of ways through the Q&A. So be interested to get each of you maybe just a quick view on that aspect of it.
Well, I'll go since I bothered to unmute myself, but I'm going to defer to the World Health Organization. Look, again, getting the vaccines where they need to go, I think, is the most important aspect, and making sure that when they arrive there, they are authentic and that they are life-saving, as we've promised people. And so anything that we can do, I think, trumps any aspect of the privacy issues. Not to say that they're not important, but when you're in a pandemic, you don't necessarily stop to read the instruction manual. Sometimes you have to just go. But I'll defer to Lisa and others on the privacy issues.
Sure. Thanks. That's an incredibly interesting question. Obviously, the first and the most important component of traceability systems is making sure we can get the vaccine safely from the point of manufacture through all the different steps in the supply chain, and then safely and while maintaining its quality all the way to a patient. And so when you do that, you're gathering quite a bit of data along the way. And I think obviously the most important data point is the one where you try to attach it to a patient. And so you obviously have numerous places where that data can be corrected. I think some of the things that we do want to look at are not just how the data behind a traceability system is used, but one of the places where we are seeing some pilots coming up is trying to develop what's called a patient identification card, so that the patient, I think people are familiar with the yellow immunization card that says when you were maybe immunized with yellow fever or something else, and you carry it with you. And when you go to a country that requires it, you show it. And the issue of asking a patient to show, or in this case, a person, to show their medical information has some ethical concerns. And so the more this electronic information that allows us to have or facilitates a patient being able to show whether they were vaccinated or not is not necessarily something that we haven't done before, but it's the scale to which it's being done that I think creates the risk. And so when we look at, some countries are already starting to run pilots to see if they can link a vaccination to an electronic patient card. And in at least one pilot that we know of, they're trying to link that to their customs authorities so that they can actually track a person who's moving and know whether or not that person has been vaccinated. There will be an unending number of ethical questions about how that information is used, how it's tracked, and how it's safeguarded. This information and the sharing of this information, however, is not new. People have required sharing of information around immunizations for a long time. But again, what creates the risk here is the scale to which the information will be in one place. So that is something that it's a real concern, and it's not an easy question. You have to balance. We're going to have to be balancing between rights to privacy, but also the need to actually use that information for public health purposes. And so, at what point do data breaches create a situation where that information is misused? There will be certainly data teams working on those issues. The good news is that there will be a lot of data teams working on those issues. And I think that the reality is that we are going to have to put safeguards in place, in not only globally, but at national levels, to make sure that any patient information isn't used in a manner to, and I think from our standpoint, when we look at policies around data governance, any kind of policy that we look at asks questions about, does it put a particular group of people at risk? Does it put someone at risk because of their gender? Does it put somebody at risk because of their socioeconomic class? Is the way that you're managing data efficient from both a cost standpoint and from a management standpoint? In other words, is it something that you can actually do? So as those systems are put in place, those types of policy questions should overlay the development of the system to make sure that when you get to that point where you start worrying about data privacy and data security, that you haven't put something in place that's impossible to manage. And so again, going back to that, it's not going to be perfect question, is that as you put those building blocks in place, you do have to be mindful of what that environment looks like in terms of, who might be targeted, how they might be targeted, whether you put a system in place that is unmanageable or unsupportable financially, because those are the things that will create that risk or that risk of a breach later on. And so again, that whole data management aspect that moves you toward patient privacy has to be managed in those building blocks along the way as you build your traceability systems.
Thank you, Lisa. Yeah, Evdokia, thank you for joining as well. I don't know if either yourself or Sigmars have kind of any thoughts on this topic.
Yes, if I may.
Jared, yes, please.
Because, of course, the privacy is not a new topic. I mean, we see that electronic medical records are here in place in many countries. And of course, these questions have been asked at that point as well. And so what we do now is that we actually add medication, and in this instance, just the vaccine information to these medical records. I mean, we can, and then, of course, we have to answer the same question as that we have answered for in the previous part when these medical records were set up. So this discussion in itself is not new. And when we look at the traceability of the medication in itself, of course, that in itself is not really a privacy problem. Only when you link it to the person, then the issue of privacy comes in the picture. And so that has to be answered at that point. But again, most countries have already been thinking about this. And of course, this has to be added to everything that has already been in place in these countries.
Thank you, Charlie. Well, everyone, we are at the top of the hour. The time has flown by quickly. I'd just like to thank all of the panelists for an incredibly insightful session. This is clearly not going to be the last time we are having these discussions, and I look forward to all of our organizations collaborating to what we all have as a goal in terms of the successful outcomes of the vaccine project. So with that, Ulrika, I'll turn it back to you. And again, thank you for organizing this, and that's been incredibly helpful. Thank you.
Thank you very much, Greg, for moderating this panel session, and a big thank you to all the speakers, Lisa, Tom, Jalling, and for sharing your insight. Let's not forget, behind the 2.1 million, there are persons who died, there are families who are mourning. So I think we all need to do what we can to improve the supply chain, and GS1 for sure is ready to support wherever we can every collaboration and to provide a platform also to inform and to discuss. So thank you very much, and I hope that we can continue this dialogue with a second executive session in the future. And in the meantime, all please stay safe and healthy. Thank you so very much.